Good day everyone. I am Michelle Anna. My metric number is H2280791. I am going to present my group assignment, that is topic is leukemia. First of all, I am going to introduce my group members, that is Idris Shah bin Nazir, Muhammad Amirul Amin bin Muhammad Nazlan, Nur Atika binti Qasim, Nek Putri Syazwani binti Nek Ahmad Kamil. Introduction. Leukemia is a blood cancer caused by a rise in the number of white blood cells in our body. The Greek words for white is leukos and blood is haima are the source of the word leukemia. Leukemia is also blood-forming tissue such as the bone marrow that is affected by cancer and produce a large number of aberrant blood cells that then enter bloodstream. There are 4 types of leukemia such as acute lymphocytic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, and chronic myeloid leukemia. Leukemia is typically diagnosed by examining a patient's blood sample under a microscope, performing a complete blood count (CBC) or using flow cytometry. Either B lymphocyte or T lymphocyte develop from the lymphoid cells. The early symptoms of leukemia is fever, bone pain, loss of appetite, headache, night sweats, and unexplained weight loss. There are some factors including smoking, ionizing radiation, petrochemicals, and Down syndrome. Treatment for leukemia patients is chemotherapy, radiation therapy, and supportive care.
My name is Nur Atika binti Qasim. My metric number is H2280260. So we will continue to the next part, which is structure involve normal function in leukemia. In a healthy individual, the bone marrow produces blood cells, including red blood cells, white blood cells, and platelets. The red blood cells carry oxygen to the body's tissues and organ and remove carbon dioxide. The white blood cells are responsible for fighting infections, and the platelets help with blood clotting. Also, leukemia is a cancer of the blood and bone marrow that occur when the bone marrow produce abnormal white blood cells called leukemia cells. These abnormal cells are not able to function properly and can accumulate in the body, then can cause a range of symptoms, which is fatigue, easy bruising, bleeding, frequent infection, and anemia. There are several different types of leukemia which are classified based on the type of white blood cells that is affect and how quickly the disease progress. Treatment for leukemia often involve chemotherapy, radiation therapy, bone marrow transplant. This treatment can help to kill the leukemia cell and allow the bone marrow to produce normal blood cells again. Lastly, in a normal healthy individual, the bone marrow is responsible for producing blood cells, including red blood cells, white blood cells, and platelets. White blood cells, also known as leukocytes, are part of the immune system and help to fight infection. That's all for my part. Thank you.
Now we'll talk about when does leukemia happen. Leukemia happens when a single cell in bone marrow changes and cannot develop normally. Bone marrow produces an excessive amount of abnormal white blood cells which don't function properly. Blood cell, or we call stem cell, it can develop into either myeloid cell or lymphoid cell. For the risk factor when myeloid leukemia happen from smoking, exposed to high doses of radiation, certain blood disorders, and certain genetic disorders. After that, we talk about white blood cells, or we call lymphoid cells. It can develop a lymphocytes and natural killer cells. Risk factors when lymphoid leukemia from having certain viral infections such as Epstein-Barr and high doses of radiation.
So we're going to the next presentation. I'm going to present about how does leukemia disease happen. So leukemia is a cancer of the blood or bone marrow which produce blood cells. Leukemias happen when there is a problem with the cell productions. It usually affects the leukocytes or white blood cells. Leukemia more often affects people aged over 50 years old, but it is also most common cancer in those aged under 15 years old. So for the next slide, in leukemia, the blood cell grows too quickly and do not function effectively and do not die at a natural point in their life cycle. Instead, they build up and occupy more space. As the bone marrow produces more cancer cells, they begin to overcrowd the blood, preventing the healthy white blood cell from growing and function normally. This is also affect the platelets and the red blood cells. Eventually, the cancerous cells outnumber healthy cells in blood. And also the aspect they also include, which is the effects of the leukemia disease. Actually, start with history of the sentence infection, such as Epstein-Barr virus. Second, having a high or low birth weight, exposed to the pesticides and air pollutions, having a parents who smoke, having a genetic condition such as Down syndrome or Klinefelter syndrome. Next, previous history of the cytotherapy. And then lastly, having already have one type of the blood cancer. Actually, there is more type. There is actually more type of the leukemia disease happen. So I only write this point in my presentation slide. So I think this end. We going to the next presentation.
So we go to the next part, which is can we prevent this disease and how to do it. So firstly, quit smoking. Smoking is considered to be responsible for more than 30% of these tumors, making it a significant risk factor for the development of AML. Additionally, it appears that maternal smoking during pregnancy and even passive smoking while pregnancy may raise the incidence of childhood leukemia offspring. The hazardous substances found in tobacco smoke include benzene and formaldehyde. These substances are easily transported throughout the body when they are inhaled into the lung and then into the bloodstream. So we go to the second one is keeping onto a healthy weight. Regular physical activity benefits your overall health and may help reduce your chance of leukemia. The danger of various solid tumors can be decreased by physical activity. But the risk of leukemia has only been considered. Developing a balanced diet including a variety of vegetables, wild fruit, low-fat dairy products and healthy oil and etc. So the third one is having a healthy diet. A typical Western diet includes items like processed meat, refined grain, sweets, convenience meal, healthy fat dairy product, and beverage with lots of calories. The product diet, on the other hand, place on emphasis on low-fat dairy product, fresh product, whole grain and juice, fish, bean, legumes, boiled potatoes, olive, fruits, and olive oil are among the staples of the Mediterranean diet. Lastly, maintain a healthy weight. Your risk of leukemia may also be influenced by your weight. Numerous studies have revealed that having exercise weight or obesity raises your risk of developing AML. However, all of the major kinds of leukemia were examined in the review of paper published in 2011. A BML of 30 or above was found to be associated with an overall risk of adult onset leukemia that was 17% greater than of individuals of normal weight, but without being overall BMI of 25 to 39. We go to the last slide, which is conclusion. So the first one is leukemia is a cancer of the blood and bone marrow that occur when the bone marrow produces abnormal white blood cells called leukemia cells. The second one is leukemia can be a serious and life-threatening disease, but with early detection and proper treatment, many individuals with leukemia can achieve long-term remission or even a cure. So that's all from my group. Thank you.